If you have pain or spasms in between your shoulder blades, or you have pain in your chest, or your arms are tingling or numb at night when you sleep, you probably have a tight chest. Let's verify that. Let's do the pencil test. You're going to grab a pencil in each hand, drop them down by your sides, shake them out, stand up. If the pencils point towards one another like this, you probably have a tight chest. If, however, you go down like this, and you come back up, and the pencils are pointing straight forward, you probably don't have a tight chest. You've taken the pencil test, and you have a tight chest. The first thing you want to do is statically releasing the muscle. And how you do that is with a ball. You can use a lacrosse ball, or a softball, tennis ball. Any ball will work, really. The bigger the ball, the more area it will cover, and the less intense it'll be on a specific area. If you're just starting, I'd recommend a softball. You're going to be on the floor, on your stomach. Put your arm with the elbow about shoulder height. As soon as you find a tender spot, just hold. Anywhere from 30 seconds to 2 minutes, until the muscle relaxes over the ball and there's no pain. You're going to be on the floor, on your stomach. Put your arm with the elbow about shoulder height. Find a tender spot in your chest. Roll in and out 5 times. Stop here, and then raise your arm up and down 5 times. And then repeat the process on as many tender spots as you can find in your chest. You've done static release for your chest, and now it's time to do a chest stretch. You'll find a door jamb. Put your arm in the door jamb with your elbows slightly higher than your shoulder. You're going to step forward with the inside foot. Keep your upper body upright. Lean forward by bending the front knee so your whole body moves forward as a unit until you feel a stretch in your chest. And you're going to hold that for a count of 10. When the 10 seconds are over, you're going to isometrically contract your chest by pressing your elbow forward and hold that for 5 seconds. Release the contraction, then move forward more by bending the front knee again, and then hold that end range for 10 more seconds. When that's done, squeeze the chest again by pressing the elbow forward again for 5, 4, 3, 2, 1. When that's done, relax the contraction again and bend forward even more. Hold that spot for 10 seconds. And that's your chest stretch. The middle trapezius static release looks like this. Take a lacrosse ball, put it in between your shoulder blades on one side of your spine, and lean back, trying to find a tender spot or a trigger point, and just relax. Your shoulders are back and down, and hold. The protocol is 30 seconds to 2 minutes, or until there is a release that is felt. You can also increase the intensity of this particular release by taking the arm that the side the ball is on, bringing it across your body, and support the elbow with the opposite hand. That will open up the shoulder blade and allow the rhomboids to be exposed more to the compression effect of the lacrosse ball. The second step in releasing the rhomboids and middle trapezius is the dynamic release. You'll take a lacrosse ball, place it at shoulder blade height on one side of your spine. Lean back onto it, pinning that muscle in place. Once you do that, raise that arm up as high as you can comfortably go and hold for 2 seconds, and then back down. And when you're first starting out, you may only be able to go to here, and there'll be a catch. You won't be able to go any higher. Don't power through that. Just slowly work on it, and this may take several sessions until it goes higher. So what you're doing is releasing the muscle through a range of motion. And you should eventually be able to go all the way up. You want to do between 8 and 15 repetitions. You place an arm in each loop, place the pad on the chest. Women will put it above their breasts. You're going to bend your elbows, squeeze your shoulder blades back and down until you feel the contraction in between your shoulder blades, and hold for a count of 5. Relax. Do it again. And try not to raise your shoulders up while you do this. Look in a mirror the first couple of times you do it. Relax. And that's how you use the stand up straight, to strengthen the muscles in between your shoulder blades. You'll find a doorway, reach through it, and grab it with your thumb down. Step forward with the opposite foot, and lean back until you feel that stretch in between your shoulder blade. And hold for a count of 10. Contract that muscle by trying to pull your arm to your body, and hold for a count of 5. Relax that contraction, let the body move back into a new stretch point, and hold for a count of 10. Contract the muscle again and hold for a count of 5. Relax it and lean back even more, and hold for a count of 10. And that's how you stretch the muscles in between your shoulder blades.